All right, everybody. Hope you're doing well. I really appreciate y'all for stopping by the October edition of AOPA's Advocacy in Action webinar. If we haven't met, I'm Sam Miller, AOPA's State and Federal Advocacy Manager, and today I kind of wanted to provide an update on our federal legislation that's currently making its way through Congress. That's the Medicare O&P Patient-Centered Care Act. And as I'll kind of discuss, the House version of the bill has been introduced for about 4 months, 5 months now. So just thought it'd be good to provide just a good status update on where we're at and where we'll go kind of going into Congress or going into 2024, the second year of this Congress. I can do, there you go. Cool. So the bill, if you're not aware, it has three provisions. Two of these are carryovers from the previous version that we introduced in the 117th Congress. And then there's one entirely new provision. The first provision, this is a carryover. It prohibits drop shipping of custom orthoses. And this is largely a effort to combat fraud, waste, and abuse in the Medicare system and hopefully save some money. The second provision, it exempts practitioners from requiring a competitive bidding license to provide off-the-shelf orthoses. And this is largely a patient access provision to make sure that folks don't have extra barriers to care, so they don't have to be sent to a completely a different location when their provider does not have an OTS license or a competitive bidding license to provide OTS orthoses. And the third provision is the new one. This removes reasonable useful lifetime restrictions for custom orthoses. And again, this is definitely a access to care issue, just to make sure that folks get devices that they need in a timely manner in cases of, physical changes to their body, or if their devices experience regular wear and tear before the kind of the expiration date, quote unquote, runs out. So in terms of the bill status, as of this week, the Senate is to be introduced. We're kind of getting towards the end of that process right now. We're working with Senator Mark Warner and his staff to introduce, and then Senator Steve Daines is also in play to assist with introducing that as an original co-sponsor. But in the House, we do have a bill. It was introduced in June, and it is HR 4315. So I can provide a little bit of a timeline for this bill since it was introduced, or around the time it was introduced. In May of this year, there were a lot of advocates showing support for the bill at AOPA's policy forum, which took place in Washington, D.C. This had over 100 participants. I believe there were 133 total policymakers that we met with. It was about a quarter of Congress, which was incredible to show the support for this bill amongst legislators on the Hill, to let them know about the field if they weren't aware already, and to advocate for patient access and kind of reducing wasteful spending in the Medicare system. And here I have some pictures that folks took out on the Hill. If you haven't been to Policy Forum, I highly recommend it. It's a really good time. So in June, the next month, the House version of this bill was introduced by Representative G.T. Thompson. This was on the 23rd, I believe. Yes, June 23rd. Just making sure I didn't skip a slide there. So in August, Representative Thompson, kind of as the champion of the bill, as the introducing sponsor, he sent a Dear Colleague letter to fellow House members, urging them to co-sponsor the bill. These are pretty much what they sound like. It's essentially saying, hello, Representative Joe. we'd really like you to co-sponsor this bill. It has these provisions. It'll help the American public in this way. And in addition to that, we also we kind of resent that bill almost. I know that the congressional system, their email system, has a way to send dear colleague letters directly to offices, but some staffers put them going to their spam folder for whatever reason. So what we did was we kind of took the letter, sent it separately to folks to make sure that everybody got it and that it didn't kind of fall through the cracks. And that's definitely an important thing to get around those little kind of spam junk issues that sometimes happen with email systems that I'm sure we're all very aware of when working. And similarly, in September, Representative Thompson, he provided testimony in support of the bill during Member Day hearings at the Energy and Commerce and Ways and Means committees. These are the bill's committees of jurisdiction. So once it's introduced, it'll then get heard in E&C first, and then it'll be heard in Ways and Means. And so essentially, although this isn't quite a markup, they're kind of slightly different. A member day hearing is essentially when any member of Congress, regardless of which committee they're a part of, can go to either of these committees and talk about bills that they think are important. So that would be kind of different than a traditional hearing in the Energy and Commerce or Ways and Means Committee where a committee member brings up the bill to be heard and marked up. I just got a question from Paula. That's a great question, Paula. So they use trained staffers. A lot of them are kind of versed in the healthcare space. And some staffers are aware of kind of the O&P space, but there definitely is a range of kind of experience and knowledge. And what we found in many cases is that it's important to, when we're talking with staffers, to kind of start with the basics. And, even sometimes it's saying, do you know what an orthosis is? Or do you know about kind of DMEPOS and that benefit within Medicare? And sometimes they'll know, sometimes they won't. And either way, it's a good educational kind of session to talk to them about this area and just to make sure that they're aware so that they're more informed when other bills that kind of deal with the space are also brought up so that they're, co-sponsoring bills, supporting bills that are amenable to this profession. So kind of continuing on with the timeline, or, this is the current space that we're in. The bill has 21 total co-sponsors, the House side at least. So that's one primary sponsor or introducing sponsor who writes the bill, introduces it. That is Representative G.T. Thompson, who I referred to earlier. And then we also have four members who are known as original co-sponsors. And they essentially signed on to the bill before it was introduced to show their support. And that is Representatives Angie Craig, Brett Guthrie, and Mike Thompson as well. And so we have quite a bit right here. I'll show you this co-sponsor list right here. This is, excuse me, all of our co-sponsors at the moment. I'm kind of have to squint a little bit to see the actual states and the parties that are involved, but we do have a pretty good spread of Democrats versus Republicans. And I think a lot of this is because the bill is very, it's got something for everybody. The Medicare fraud prevention provision is something that draws Republicans in so that it helps with the budget. And then the healthcare access, that the reasonable useful lifetime and the kind of competitive bidding license exemption provisions, those really help with the patient access, and they appeal to Democrats. But if you look at these co-sponsors, I've highlighted those in red who sit on the E&C and the Ways and Means committees. So these are the committees that are going to be hearing the bill, as I referred to earlier. And so to have this many already, a good chunk of our co-sponsors being on the committees that are going to be hearing the bill, that's very helpful. And that is a big part of our strategy, is to meet with members who are on these committees of jurisdiction, make sure that they are aware of the bill, and so that they can either, choose to co-sponsor it right now, or when it gets heard, that they'll at least have knowledge of it and hopefully will sign on once it's able to be voted on in committee. And this is kind of another visualization of our co-sponsor statistics. And so we have 16 states plus the District of Columbia represented by our co-sponsors. And so hopefully we're going to be, increasing the range of this map even more, but it's really helpful to know that we have co-sponsors from, every single corner of the country. And so this is kind of the Senate status. I kind of spoke about this a little bit earlier, but we have Mark Warner and Steve Daines as introducing sponsor and original co-sponsor, respectively. And then we also have some potential other original co-sponsors that we've been speaking with. These are Senators Tammy Duckworth, Bill Cassidy, John Cornyn, Chuck Grassley, and John Thune. And these are the co-sponsors from the last Congress who we're hoping continue to show their support for the bill going into this Congress and will help shop the bill around to other folks. And in this case, the Senate Committee of Jurisdiction that the bill we heard in is Senate Finance. So the good thing about the Senate side is it only has to go through one committee rather than two, and that would expedite the timeline quite a bit. And as I mentioned earlier, Colleen Wynn in Senator Warner's office she's making final preparations. She's kind of awaiting the green light from Senator Warner, and so we're hoping that happens relatively soon. We're going to Joe McTurnan, my colleague. He is attending a fundraiser with Senator Warner in next week, and then I'm also going to be attending a kind of a reception with Colleen next week as well. So hopefully we'll be able to shop that around and kind of make a final push for introduction at that point. So this is kind of a snapshot of what's next with the bill. So the first thing I'd like to mention is a CBO score. This would be a kind of a fiscal analysis. The CBO stands for Congressional Budget Office. And this allows legislators to understand the bill's impact on the budget. We're working with CBO right now, but we've also engaged with a private kind of firm to perform an analysis of the bill that'll hopefully be persuasive to legislators and will also help CBO move their analysis along as well. And I think that the aim of this is that we'd like to see, ideally, that the fraud prevention provision of the bill, the savings outweigh the potential costs that the reasonable useful lifetime provision would create. So ideally, we'd be saving the government money through the Medicare program, but I think a revenue neutral bill would be great too. And that would just create a very appealing piece of legislation for everyone. And so, as I mentioned earlier, kind of the next step after introduction is getting heard in committee. On the House side, once we generate support in E&C and Ways and Means, the bill will need to be officially kind of brought up in the hearing, and then it'll be marked up where committee members can debate potential amendments and then kind of decide whether it'll go to the House floor. And then the kind of the third potential path that the bill will take is being attached to a legislative vehicle. Aside from the typical route where bills, move independently, they get in committees, go to one chamber, go to the next chamber, etc., become law. They can also be attached to larger must-pass spending bills known as vehicles. And in this Congress of this day and age, it's very polarized. I think that a great deal of the bills that are passed are these vehicles, and because they need to fund the government, and so this route has become more and more commonplace. They kind of get attached and move along. So that is something that we're considering for our bill as well. And finally, I'd like to make a plug for aopavotes.org. This is where you can put in your information into this kind of field below, and you can automatically have a letter sent to your legislator based on your zip code. And this is really helpful to get these numbers up, especially in concert with people like myself, Joe, and Eve Lee, our executive director. When we send meeting requests, when we're going to fundraisers and we're able to speak to legislators and their staff directly, it's often helpful for when the legislators go back to their office and they ask, how many people have interacted with our office about this bill? And then their staffer can maybe say, oh, 20 people sent in letters about this bill in the past week. Then they'll realize that this is something that their constituency cares about, and they're more likely to co-sponsor or to kind of meet with us and engage on the bill that way. And so I'd appreciate it if you haven't already sent a letter, to use this QR code right here to go to that website. It's aopavotes.org and send a letter. That would be extremely helpful, and would really appreciate that. And finally, just wanted to see if anybody had any questions about the bill. I'm happy to take those. All right. Well, not hearing any questions. Speaking of AOPA votes, I'd like to award our Advocate of the Month for this month. That would be going to Lauren Decker. I really appreciate you for getting involved with AOPA votes and sending a letter to your member of Congress. And we will be kind of in contact with you shortly for your prize. Really appreciate you for getting involved. Thank you.
Sam, it does look like Paula has some questions.
Oh, yes, Paula.
Yes, thank you. So I have a couple of questions. I am a Virginia resident, so meeting with Warner is an interesting fact. So the questions are, when you are meeting at this fundraiser, are you having Virginia residents that specifically use either prosthetics or orthoses at this event? Because I think it would be useful and certainly pertinent if they meet an actual Virginian using the items. All right. Is there a separate number for the Senate bill? It may not have been already assigned. I'm not quite sure. And then I know that often things are added into larger packages. It's the way of the Congress, so to speak. However, my concern is when they add things such as this, which in some people's mind is not important, it gets buried. And then what happens if it's so deeply buried into some 2,000-page item that we never see the light of day of it again?
No, those are great questions. I think to the first one, I think it is very helpful to have patients involved in these in meetings with legislators. We do try to do that as much as possible, especially policy forum is really helpful for that, because we have 100 people, many of them parts of the community themselves, walking around Congress, and just even walking the halls, having staffers see somebody who has limb loss is really helpful for them to know about the field and to be aware of it. But I think for fundraisers, it depends, only because the actual prices of the of the tickets to fundraisers is quite heavy sometimes, and we are trying to use our PAC dollars sparingly in a way, but we do try to do that as much as we can. Yes. And then to your question for the Senate, we don't quite have a number yet.
Okay.
That's kind of going to be that last part. So hopefully that'll be soon. We've been kind of talking with Colleen quite a bit about that. Hopefully I'll have some good news soon. And then your third question, I think that is definitely a concern. You don't want to have kind of that little small paragraph in like page 1500, or something like that. But I think that's definitely an issue of being engaged with Medicare itself and CMS, and letting them know, that this passed, and making sure that they know that it's a priority for national organizations like ourselves, or the Amputee Coalition, for example, that it's important for patients and provider organizations, and hopefully that will help in the kind of implementation process, that we can let them know that this passed, this is important to us, and we're here to help make sure that this regulation is as helpful for patients as it can be.
Great. I was on the Hill with ACA in April.
Nice.
It was interesting. The thing that I found was most of the staffers, I think, were giving more of a nod and a wink. I've tried to follow up with all of the staffers that I met with and have yet to see any kind of response. And as you know, that was back in April. So more push definitely is needed.
Yeah, the getting in contact with staffers can be tough. That's for sure. I think it's a lot of it is kind of pestering in a word that's not the best word to use, but just making sure that we're just the squeaky wheel in that situation. Absolutely, is just getting their attention and keeping it is the key.
I'm a double lower limb.
Got it. Absolutely. And it's great to have you in April. That's great to hear that you were there.
Thank you.
Does anybody else have any questions? All right. Well, I appreciate you all for coming. Laura and I'll be in contact with you later today, and appreciate you all for coming. Hope to see you at the November version of Advocacy in Action. Thank you all.
Thank you. Bye-bye.